Pregnancy is a wonderful experience, but it comes with challenges, especially when it comes to sleep. Many expectant mothers make common mistakes, which affect their comfort and health at night. One of the biggest mistakes pregnant women make is sleeping on their back. Lying flat on your back puts pressure on a vein that carries blood to your heart, which can slow down blood flow to your baby and make you feel dizzy or out of breath. If you are still sleeping this way, try sleeping on your side, especially your left side, which is best for circulation. Another common mistake is not using pillows for support. Putting a pillow between your knees can ease the pressure on your hips and lower back. You can also place a small pillow under your belly to support it and feel more comfortable. There are also special pregnancy pillows made to support your whole body. The Mom Cozy Full Body Pregnancy Pillow offers excellent support to help expecting mothers sleep safely on their side, which is the best position during pregnancy. By hugging the entire body, it prevents tossing and turning, allowing for deeper, more restful sleep. It also eases pressure on the lower back, helping avoid common pregnancy sleeping mistakes. Sleeping on your stomach is another mistake, which becomes more serious as your pregnancy moves forward. In the first few weeks, it might still feel okay, but as your belly grows, it gets uncomfortable and even harmful. If you are used to sleeping this way, it is a good idea to slowly start training your body to sleep on your side instead. Using too many soft or big pillows under your head can cause problems. Some women think it helps with heartburn or breathing, but it can make your neck bend in a bad way. It is better to use a small wedge pillow, or gently raise your upper body to stay comfortable and supported. Not paying attention to posture when getting in and out of bed is a small but important mistake. When you sit up quickly or twist your body the wrong way, it can cause back strain or dizziness, especially during the later months. The right way is to roll to your side first, then push yourself up slowly with your arms. The same goes for lying down, but always do it gently and avoid sudden movements. A hot room or a hard mattress can make it harder to sleep. To sleep better, keep your room cool, wear light clothes, and make sure your mattress is firm enough to support your body. Lastly, thinking it is just part of pregnancy and ignoring discomfort is a common but risky mistake. If you are not sleeping well or feel pain, do not just ignore it. Talk to your doctor or midwife. By making small changes to your sleeping positions and habits, you can significantly improve your comfort and health during pregnancy, ensuring you get the restful sleep you deserve.